Confusion and chaos have been reported in the communities actively working on developing cures and treatments for diseases. And that's because as the Trump administration has moved in, it has temporarily frozen external communication, traveling, and hiring within many federal health agencies. And while it's a pause for now, someone who has worked clinical research for decades tells our Sam Stark he's worried.
Last Tuesday, heads of federal health agencies, including the National Institute of Health and the CDC, received this memo. It instructed those heads to immediately put a pause on external communication and public appearances until February 1st. In addition to this, scientific research publication Science said the administration had ordered a freeze on hiring and an indefinite ban on travel within those agencies.
Depending on how long this goes, it could disrupt that innovation at the beginning that we'll start to see later down the road in 6 months, a year, when we see a decline in the new opportunities coming to patients.
John Potoff is the chairperson for Allego Health Research based out of Austin. He said it is not uncommon for there to be a brief pause during these transitory periods. A longer delay, however, could disrupt innovations in treatments for diseases like cancer, diabetes, and Alzheimer's disease.
That can set us back not only from a timeline perspective, but it can just reduce the number of opportunities that we have to really bring something life-saving to patients.
In 2024, the NIH released $116 million to the University of Texas at Austin, which funded around 250 projects. The university would not comment on whether this freeze would disrupt research operations and output.
Diabetes, Alzheimer's attacks everybody, no matter what your background is. So it's important that we stay focused on what's really important, which is making sure we do things to save people's lives.
Sam Stark, KXAN News.
And the National Institutes of Health disperse billions of dollars every year to fund around 50,000 research projects around the country. In a letter obtained by NBC News Today, the NIH director said clinical trials can continue as scheduled.